Well, welcome back, everyone. Thank you for your continued attention to the work that we're doing here and to our, as we go into our next presentation. We now are going to shift the remainder of today's agenda by focusing on key priorities related to the immediate challenges that are impacting AA and NHPI communities. We had a little bit of this from our former commissioners. They gave us some insights. The first segment will focus on health and economic impacts of COVID-19. It continues, it is going to continue, and this is going to be important for our communities. As many of you know, the pandemic has significantly impacted AA and NHPI communities, and like all communities, but also has had a disproportionate negative impacts specific to AA and NHPI communities across the nation. These impacts are often related to physical and mental health, business-related concerns, and however, these disparities and impacts may not be as widely publicized or known to the general public. Our communities know about it, but the public itself doesn't always know about it. So today, we have the pleasure of having Dr. Cameron Webb, who is a senior policy advisor for equity at the White House COVID-19 response team. They have been doing yeoman's work, and I'm not sure they've had enough time to sleep in the last year. Dr. Webb is former assistant professor of medicine and public health at the University of Virginia School of Medicine. He has worked in the university's COVID unit since the beginning of the pandemic. Let's welcome Dr. Webb. He has he's going to share some key information with us on how COVID-19 has impacted AA and NHPI communities. I know he's on the phone because he wasn't unfortunately able to get on the camera, but we will get to listen to him. So Dr. Webb, we're really happy to have you here.
Thanks so much for having me. It's good to be with you. And actually, at some point in the next probably 2 or 3 minutes, I'll be able to get to a computer. So maybe you'll see my face shortly. But we'll go ahead and jump in because I think it's so important to talk about really the health consequences and impacts of this COVID-19 pandemic on AA and NHPI communities. And I think that, so often when we talk about COVID equity, I think people lose sight of exactly what that means, all the different domains and dimensions by which we're looking to ensure an equitable COVID-19 response. And by equitable, we mean that every community and every place has the opportunity to not just survive, but thrive through this pandemic, and that we're paying close attention to the disproportionate impacts that the pandemic is having on folks. And so really just pulled together some slides for you. And so as you can see from the deck there, it's described as COVID-19 equity, understanding and addressing pandemic dynamics in AA and NHPI communities. Next slide, please. And as we jump in, I think the first thing I want to do is just look at COVID-19 impact at a glance. And if you look at the slide here, this is from CDC, and you see something that's probably pretty familiar to many of you. You see that, on the bar graphs that you're seeing, first, you'll see that these really high rates, this is age-adjusted, lab-confirmed COVID-19 hospitalization by race and ethnicity. And so the first thing you'll see is that for American Indian, Alaska Native, the rates are really high. For non-Hispanic Black, really high. For Hispanic and Latino, really high. For non-Hispanic White, it's lower. And then lowest is for non-Hispanic Asian and Pacific Islanders. And so people would be led to conclude from this slide that group is doing pretty well, and we shouldn't devote our resources or attention to addressing those needs, but instead we've got these other problem areas. Next slide, please. And I think similarly, you can look at this next slide. This is from Kaiser Family Foundation, and so this is the percent of the total population that's received at least one vaccine dose. So, vaccines certainly aren't everything. There's a lot more to this pandemic than just vaccines. But we know that a lot of people are looking at that as our key way through this pandemic. And so we often look at and track the vaccine access and uptake as our way of knowing where we are and how we're doing. And similarly, you look at this slide and you see all the different communities that are depicted here. You see in terms of the vaccination rate among white adults and among Black adults, Hispanic adults. And there's one that's far and away above the rest, and that's Asian individuals. And it's at 83%. Everybody else is grouped around the mid-60%. So if you were asking yourself, well, where should we focus our energy and attention? Yet again, it's going to direct you to other groups rather than the Asian population. Next slide, please. And I think that what this does, and this is one third slide, this is looking at the vaccination effort in children. And this actually broke down different communities. So you see Connecticut, D.C., Michigan, Minnesota, North Carolina, South Carolina, and Vermont. And if you look, there's one bar that stands out above them all, and it's, again, in Asian children, much higher vaccination rates. This is, precisely the kind of challenges that I think we need to be thoughtfully navigating here, because experientially, we all know that this doesn't tell the full story of the pandemic in Asian American or NHPI communities. What it tells is the story of this aggregate perspective, and it reinforces the really troubling, really challenging model minority stereotype that's made it hard to mobilize resources to communities that have been truly, really hard hit by this pandemic. Next slide, please. And so, I think the first thing I like to depict, and of course, we're among friends here. I say this is choir practice, and so I understand I'm preaching to the choir, but even still, if you look at the Asian American, it's referring to many ethnicities, and I really like this graphic from NPR, because it just shows here in the United States just how many different ethnicities are depicted when we talk about what we mean by Asian American. Next slide, please. So on the one hand, it's many ethnicities, but beyond being many ethnicities, it's also many languages. And this is a slide that just depicts the third most common language spoken. So there's English and Spanish, and then this is what's third. And you see so many different languages that are described here, which really in some ways kind of heralds the notion that there are a lot of different types of communities that are described, that are depicted. So you see Vietnamese, you see Tagalog, you see you see Chinese, you see lots of different, you see Korean in different parts. I'm here in Virginia. That's we have. So you see there's lots of difference, lots of variation there. Next slide, please. So many ethnicities, many languages, many experiences. And here we see, and I know we'll talk about this some more later, but on the x-axis, you see the percent of adults age 25 and above who have at least a bachelor's degree. And on the y-axis, you have median household income. And so to describe this as a monolith, to describe this as all one community would be folly. But not only that, we know these same factors, these same experiences drive COVID-19 outcomes. And that's what makes it the most challenging. We know that these are the very factors that increase the likelihood that somebody's a frontline employee, that increase the likelihood that someone has multiple chronic conditions. And so it's hard to describe this as a single entity, a single group that's all having shared or similar experiences. Instead, we know it's many experiences. Next slide, please. And so, here's the data that we pulled most recently from the CDC. So this is looking at weekly cases per 100,000 population by race and ethnicity. And this is from early December through just 2 weeks ago, which really I think is the most up-to-date data that we do have from CDC. It takes a little while for states, for localities, for tribes and territories to send in their data. But you see the differences here. And so we're looking at in terms of cases, the highest case rate we see among Hispanic individuals. We see next is Black individuals, and you see the Asian and PI group is right at that same level. After that, it's American Indian, Alaska Native, and then finally white non-Hispanic. So that's the current state. Next slide, please. And so that was cases. Next we'll look at emergency department visits, and this is one where we've seen, again, some similar trends. We see the Black non-Hispanic rate of emergency department visits was the highest, and it's come down a little bit in recent weeks. You see Asian Pacific Islander is next. It's currently the highest in terms of ED visits. And then you have Hispanic, and then you have the white non-Hispanic, right? Next slide, please. Hospitalizations is next. Really saw a tremendous spike in hospitalizations in the Black community, and that's certainly been cause for a lot of concern, but we're also seeing increases in hospitalizations across demographics. And so you see American Indian, Alaska Native, you see Hispanic, you see white, non-Hispanic, and you see Asian Pacific Islander is lower down on that list. But again, don't want to be convinced that there aren't challenges there. And next slide, please. And then finally, if we look at deaths, you see a similar trend. Again, all the different demographics, but again, you see Asian Pacific Islander toward the bottom. And that tells a story. It tells a story of a difference. I'm getting logged on my computer, so you should be able to see me shortly. And I'm gonna switch gears. But I think here the takeaway is that you see all these differences, but that is when we have aggregated data about Asian Pacific Islander, which can be challenging and problematic. I'm going to switch over audio devices, and I'm going to go to the next slide. Okay, so you should be able to hear me okay. That was hopefully seamless. But I think if you go beyond even CDC's data and you say, well, what do we actually know? There's been a tremendous amount of research that's come out over the course of the pandemic that tells the true story of the pandemic on Asian American and Native Hawaiian and Pacific Islander communities. Here's an article that spoke to some of those challenges. While you see that Asian Americans make up a small proportion of COVID deaths, there's higher so you see significantly higher excess all-cause mortality, 3.1 times higher. You have higher case fatality rates, and then the higher percentage of deaths attributable to COVID-19. So mounting evidence suggesting that disproportionately low testing rates, more disease severity at case presentation, different socioeconomic factors, as I just described, and then racial discrimination, these all contribute to these disparities. And that's significant. And again, it calls for something that will become a theme. Improving data reporting and uniformly confronting racism are key components. Next slide, please. Similarly, here's another one that kind of speaks to disaggregating Asian race reveals disparities among Asian American patients in New York City's public hospital system. This was a really important paper that just showed that, again, not a monolith, different experiences for different demographics. Next slide, please. And then, when we're looking at kind of specifically with no data, there's no equity. And I believe that to its core, talking about addressing the lack of data on COVID-19 for Asian American communities, you see similarly that health data were deficient before the pandemic, not sufficient research happening, but that is, it created this misconception that there's a low share of deaths and cases. And in reality, Asian Americans, as this study found, have higher COVID-19 case fatality rates than other racial and ethnic groups, and the second highest increase, 37% increase in excess mortality in 2020. That is dramatic, significant, and worthy of significant intervention. Next slide, please. And so this is where I look to some of the bright spots. And every other week, so every 2 weeks, we meet with all of the state and local, all the state and territorial, COVID-19 equity leads. We asked every state to name kind of a person who would be their point person for equity. And the team in Hawaii has been just really a joy to work with. They even presented some of what they're doing to some of the colleagues across the country a few months back. This is how they look at the race of COVID-19 cases. And you see that they break it down a little bit differently. It's not just, Asian American, NHPI. It goes into Native Hawaiian, Pacific Islander, Filipino, Japanese, Chinese, other Asian. And I think it tells a more robust and complete story. This is looking specifically at cases overall. It tells a more complete story in terms of what's happening in this pandemic. Next slide. And so that's the story in terms of cases, but look at the story in terms of deaths. You see a very different picture when you're looking at white versus Native Hawaiian versus Pacific Islander versus Filipino, Japanese, Chinese, other Asian. You see different stories of different impacts of this pandemic on different communities. And I think that you'll see other data that will tell you that there's excess deaths in the Pacific Islander population or among Native Hawaiians. But again, you're seeing it here playing in front of you because the data was seeking to disaggregate, to really understand what's happening, who these outcomes are affecting, and really telling a complete story. Next slide, please. And I think that's why we asked CDC, what more can we do? How can we look at this in different ways? Because they say all politics is local, but all equity work is local as well. And we looked at the counties with large non-Hispanic Asian populations and recent high burden of cases. So this was just through mid-January. And you see that in different parts of the country, you have very different impacts. There are 136 counties that had large non-Hispanic Asian populations relative to the national average, and 98.5% had high recent burden of COVID-19 cases. And so that's a significant impact that COVID's having in those communities that have large non-Hispanic Asian populations. Next slide, please. And similarly, when you look at counties with large non-Hispanic Pacific Islander populations in the recent high burden, similarly, 173 counties that kind of fit that bill. And when we say large
again, 0.2% or more is what they're describing. But even still, we're seeing 96% had high recent burden of COVID-19 cases. This is just kind of a starting point or a next step in how do we really get more granular. And you can imagine how we can take data like these, overlay it with the different countries of origin or the different ethnicities that we are looking to understand what's happening. It tells a different story, and it helps us figure out what linguistically appropriate interventions look like, what culturally appropriate interventions look like, what community-based organizations or faith-based organizations or other entities, community health workers, we should be coordinating with to really meet and serve the needs of these communities. Next slide, please. And so, I think there are a couple of things that are as I say, the wind in our sails. The president announced very early on that equity would be at the center of this pandemic response and issued on his second day in office, January 21st of last year, an executive order on ensuring an equitable pandemic response and recovery. Next slide, please. And just to tell a little bit about that task force, it was charged with making recommendations on optimally allocating COVID resources, dispersing relief funds in a way that advances equity, ensuring effective culturally aligned messaging and outreach, and you can see how that's important in this context, addressing ongoing health inequities faced by COVID-19 survivors, collecting data for the hardest hit communities. Again, you can see how that's really critical, and then addressing longer term data shortfalls and challenges. And if the disaggregation of data isn't one of those, then we're missing the mail. Let's next slide, please. And so the task force was really bolstered by an additional executive order just 5 days later. It was a memorandum condemning and combating racism, xenophobia, and intolerance against Asian Americans and Pacific Islanders in the U.S. Next, if you could click, and actually if you pull out and click one more time, please, what it actually shows is the Secretary of Health and Human Services shall, in coordination with the Health Equity Task Force, consider issuing guidance describing best practices for advancing cultural competency, language access, and sensitivity towards Asian Americans and Pacific Islanders in the context of the federal government's COVID-19 response. So, really just important work there. I'm going to fast forward just a little bit. So next slide, please. We have a couple of slides that I wanted to share, and next slide as well. And unfortunately, I do have to go shortly, but I want to go to this one slide, advancing cultural responsiveness and language access. These are the recommendations from the task force. So the final recommendations came out in November. And what it says is that not only advancing cultural responsiveness and language access for Asian and Asian Americans, Native Hawaiians, Pacific Islanders, and other populations facing pandemic-fueled discrimination and xenophobia, but next slide, please. You can see what it means is the federal government should advance cultural responsiveness to language access and increase awareness of different experiences that these communities and other populations facing xenophobia and discrimination are doing by doing the following. And you can just click through about 4 or 5 different times, but requiring federal agencies to make communication transparent, culturally and linguistically inclusive, allowing sufficient funding to agencies to review enforcement of anti-discrimination protections, implementing solutions, enforcing anti-discrimination protections, supporting education about Asian Americans, Native Hawaiians, Pacific Islanders, mobilizing action plans to quickly respond to discrimination and hate crimes, and you can click one more time. And then using an equity-centered approach to create future pandemic plans and combat disinformation. That's one of the final recommendations that's here. And I know I have to go, but if you can click one more time, I have kind of a series of other recommendations that aren't the final 55 recommendations, but that still inform the task force's work. And a lot of those have to do with data. Hopefully we can share these slides with the group afterwards. So I have about probably eight or so different interim recommendations that were part of the task force's recommendations, and a lot of them have to do with data, and we're taking them very seriously. They focus in, and this is a good example, collecting and disaggregating data. So I think it's really, really important work. And if you can click all the way to the end, I think we can click forward probably 6 or 7 times, you'll see there's more interim recommendations, and there's going to be one final slide that I wanted to end with, this one right here. And it's New York enacting groundbreaking law to change how Asian American populations are counted. I think a lot of us are aware of this law. It's important because it's just more evidence that this can be done. It can be done. It should be done. It will be done. I work closely with the Equitable Data Working Group here in the White House. There's a lot of work that we need to do, and everybody understands how the disaggregation of data is part of that. Everything is impossible until it's done. But I think that this pandemic has shown us more than any time before how critical this is to the health and well-being of really a population that needs to be better appreciated and better supported through this tough time. So with that, I'll pass it back. Thanks so much for having me. I apologize I have to run, but thanks for having me today.
Dr. Webb, thank you so much for being here. And I'm sorry we won't be able to ever ask any questions, but to my fellow commissioners, this is one of the places where we can also ask for more information and have more interaction with Dr. Webb. But it's also a great example of why data disaggregation matters, and very specifically what the story told in the first slides to what we learned in the later slides when the data is disaggregated, why it matters for our communities. So with that, I'm going to go on to our next panelists to focus on economic data and national policy related to AA and NHPI communities. Please welcome Bharat Ramamurthy, who serves as the Deputy Director for the National Economic Council. He's previously served as a member of the Congressional Oversight Commission for the CARES Act and was the top economic advisor to Senator Elizabeth Warren's presidential campaign. Bharat, it's so nice to have you here, and thank you for taking the time.
Thanks so much for having me, and I'm really looking forward to this opportunity to share this information. I'm going to focus on the economic impacts of the COVID-19 pandemic and the subsequent economic recession on the AA and NHPI community. And I want to, before I get started, want to thank Ryan and Teresa from my team for helping pull this material together in advance of today's conversation. And I also want to flag, as Dr. Webb did, that in many instances, the quality of the data and the disaggregation of the data is not at the level that it should be. You know, when we're trying to understand the impact of COVID-19 on the AA and NHPI community, many of the data sets that we traditionally rely on to look at small business performance or the labor market or childhood poverty and so on are not disaggregated at the level that we would want. And so throughout the slides and the presentation, you'll see notations at the bottom when the data is not as robust and disaggregated as we want, but I still think we can get a good overall picture of what's been happening over the last 18 months or so. So if you go to the next slide. Want to cover two basic things today. First, some information on the economic impact of COVID-19 over the last roughly 2 years in three categories: the labor market, small business, and poverty. And then want to finish up with some short recommendations for further action and further study. Next slide. So on the labor market, a few headline points before we get into some of the data detail. First, the data suggests that overall employment levels for the Asian American population have recovered quite strongly since the onset of the pandemic. That's the good news. The bad news is that, first of all, the percentage of Asian American folks who are unemployed, who are actually in the category of long-term unemployed, is higher than for any other group. So basically the punchline there is that if you are unemployed and Asian American, you are more likely to be a long-term unemployed, and there are some consequences to that. And second of all, since 2008, so if we zoom out a little bit, the employment level for Asian Americans has actually declined the most out of all racial ethnic groups. So next slide. Here's the data on employment levels since the pandemic began, as you'll see on the chart on the left here, which looks at employment to population ratio. That's essentially a very basic figure, what percentage of the working age population is currently employed. And what you will see there is, of course, for across racial ethnic groups, a very sharp drop around March of 2020. And a recovery across all ethnic groups, but the light blue line, which is the Asian American population, you see that the dip was slightly less severe than it was for other groups, and that it is the only group that has, as of sort of late last year, actually recovered back to the level it was at in February of 2020. The slide on the right, or sorry, the graph on the right, tells a similar story. It looks at the unemployment rate. And you can see a similar pattern there, which is a spike around March, though not as severe as for other ethnic and racial groups, and then a steady decline back roughly to the level it was in February of 2020. Next slide. Here is the data I mentioned at the beginning about long-term unemployment. The graph on the left shows that there was an increase in long-term unemployment in September. So again, if you sort of think about it, long-term unemployment is roughly speaking 6 months unemployed. A bunch of people were laid off in March of 2020. Come September, the number of long-term unemployed starts to rise as you hit that 6-month mark since the pandemic began. And it's sort of a plateau into the beginning part of last year. And there you see the dotted line. That's the enactment of the American Rescue Plan, which was the president's economic recovery legislation. And you see a rather steady and sharp decline in overall long-term unemployment since that point. And that's important because there's a lot of economic literature talking about the specific harms and the particular harms that come with being unemployed for a long period of time. Folks who become unemployed and are able to find a new job within a few weeks or a couple of months, the economic consequences in terms of their wages and so on is not as significant. Whereas folks who are long-term unemployed, there tends to be longer-term implications in the sense that they often have to accept jobs that are at lower wages going forward, and that has lifetime impact on their overall income. So we really want to avoid long-term unemployment to the extent that we can. And as you see on the right side of the screen here, if you look at the numbers by ethnicity, this is the percent of unemployed people who were unemployed for more than 15 weeks. You see that the Asian American population has the highest rate there. So overall, a good picture, but a specific problem on long-term unemployment. Next slide. Here's data looking all the way back to 2008. I thought this was interesting because while the recent story between 2020 and today is a strong one in terms of the Asian American population rebounding very quickly, again, in the labor market, what you see is that since 2008, the unemployment level among the Asian American population has actually fallen the most relative to other ethnic groups and racial groups. So there is a longer-term issue here that is somewhat at odds with the relative success in the last 2 years. Next slide. So that was the labor market. Now I want to talk quickly about small business. Obviously, this is an area where the Asian American population is highly involved. The data here shows a few things. Number one, Asian American small business owners are more likely to work in areas that have been hardest hit by the pandemic. Second of all, and probably related, Asian small business owners are experiencing fewer signs of recovery. And third, discrimination has played a role in exacerbating the challenges for Asian American small business owners. So we can dig into all of those in a bit more detail, starting in the next slide. So this shows the areas that are that have the highest percentage of Asian American owners. So food and accommodation services, you'll see that top line. About a quarter of small businesses in that sector are owned by Asian Americans. Retail trade, you see, is the second highest, about 16%. What the lines that are indicated in dark blue, those are areas that have been that are sort of hardest hit by COVID-19. Again, not a surprise to think that food and accommodation services and the retail sector, and the one at the bottom there, education services, have been hardest hit by COVID-19. And as you can see, those are areas that tend to be where Asian American owners are overrepresented. Next slide. And again, as you would expect from that last slide, if you look at survey data, they went out and asked small business owners, do you agree or disagree that we have turned the corner on the pandemic and businesses returning to normal? And I should note that this is a little bit out of date, but the most recent evidence that we were able to find. And you can see that AAPI women and men are all sort of below the baseline level for their gender. With 50 plus AAPI women actually at the lowest of all survey groups. You see that at the bottom, only 26% agreed with that statement. So sort of the survey data tends to back up what we are seeing in other data sources about how the pandemic has been particularly hurtful for Asian American small business owners. Next slide. And I think we have to be clear that that hate and discrimination have exacerbated these challenges. This is data specifically from New York City-based Asian American small business owners, and the question that says it found that 8 in 10 Asian Americans said that violence against them was increasing since the pandemic, and 1 out of 3 feared threats and physical attacks. A related data set, if you look on the right side here, is if you look at different neighborhoods in New York, where was the overall biggest drop in consumer spending in 2020 relative to 2019? And you see that Chinatown suffered the biggest drop, a significantly higher drop than New York City as a whole, again, reflecting, at least partially, some anti-Asian bias and concern about COVID. Next slide. Last category is poverty. One of the things that we in the administration, and I think the president is most proud of, is as part of the American Rescue Plan, introducing an expansion of what's called the child tax credit. That's an additional monthly payment that goes to parents of small children. And overall, it has had a remarkable effect at bringing down child poverty over the course of 2021, approximately a 30 or 40% reduction in child poverty, representing millions of children brought out of poverty that year. If you look at the data here on this slide broken out by race and ethnicity, at the bottom right-hand corner, where it says 212,000, that is the number of Asian American children that were moved out of poverty in 2021. That represents a roughly 30% reduction. So, in my mind, a remarkable achievement and something to be really proud of. Next slide. Oh, can we go to the next slide, please? Thanks. So I want to finish up with some recommendations based on all that data. First, going back to the labor market, there's a particular issue with longer-term unemployment. And as I noted, this administration has been very focused on reducing long-term unemployment overall because there is an enormous amount of data about what's called the scarring effect of long-term unemployment, what it means for folks on their long-term earnings potential, what it means for wages over their lifetime, what it means for, honestly, on the health side as well. Making sure that people who do lose their job find a new one very quickly, that's very, very important. And so the fact that the long-term unemployment level is elevated among the Asian American population, even as the overall employment level is quite strong, means that we need to keep focusing on what to do to help long-term the unemployed, which will end up having a particular benefit for the Asian American population. Second, we need to keep building on the work that we have done already in this administration on helping small businesses. And there are a lot of options right now for small business owners who need relief. The Small Business Administration is running a bunch of programs. The Treasury Department will be rolling out a program very shortly that will be about helping small businesses grow and build. We need to make sure that that is reaching every community. I think if you have talked to a lot of small business groups, which I have done over the last year or so, one consistent problem that you hear is that small business owners don't know how to access the relief that is available to them. The ones who are more sophisticated, the ones who have an accountant, the one who may already have a lawyer, they know about these federal programs. They know how to fill out the paperwork. They know who to talk to get, a big loan or a big grant. The person who is a sole proprietor, a person who may run a small nail salon, who might run a small, corner store, may not have that kind of access. And so one thing that we did included in the American Rescue Plan, this was a particular priority of the president's, was something called the Community Navigators program. It provided funding to local community groups who would go out and dedicate people to helping small business owners access relief that's available to them. That is already starting to roll out, and we think it will be a big help because oftentimes there may be language barrier issues or other technical issues that stop people from getting relief, and we want everyone to get the relief that they're entitled to. Third, on the poverty front, as I noted, in the Asian American community, we're talking about a 30% reduction in child poverty. Unfortunately, that provision of the American Rescue Plan from last year has expired. And so it's been a priority of this administration to extend that credit so that we continue to see the benefits of that reduction in child poverty. And fourth, as I said up top, in a number of these areas, we kind of ran up against a barrier where the quality of the data limited us from making more granular analyses. And I think that we would want to push for more disaggregated data in all of these different data sets so we can better capture the experience of different parts of the AA and NHPI community. That's it. Thanks very much.
Thank you so much. I'm gonna start with asking you one question, but I'm gonna open it up because I know everybody's got questions for you. So I want to give them a bit of time too, if you don't mind. I just want to sort of link to the last sort of couple of points that you made about AA and HPI small businesses and federal programs. And I think in this case, just thinking about how, I know you have the Community Navigator program, but as that's rolling out, what are ways that this commission and others can help in making sure that information is getting out to AA and HPI communities? And honestly, how do we help them apply it? Because sometimes, you know, I live in Texas and I could see the small businesses there don't always know how to even apply, even though when they know it's there, they don't know what to do.
Yeah, so I think that there's a few things. Number one, there's often a language barrier that comes into play for these communities, and we in the administration have been very focused on making sure that when the Small Business Administration put out a sheet that says, here's a handy guide for how to apply for program X, right? And they try to do their best to boil it down to a single page of directions that somebody can follow without having to go find an accountant and a lawyer. Well, that's not very helpful if it's not available in the language that somebody speaks, right? And for the Asian American community in particular, there may be dozens of languages that we need to translate that document into so that we can, so that people can take advantage of it. That's something that we're working on. We've made a real point of emphasis. Second, the goal of the Navigators program is to find people who are well known and involved in their communities, and so they know how to reach the harder to reach folks. I mean, one thing about policymaking is that you have to be humble about what you can do and what you can't do. And one thing that the federal government, I think, isn't as good at is having contacts and resources in these smaller communities in particular areas where the best thing we can do is empower and provide resources to a community group that's been operating in that community for a dozen years and who the people in that community trust. I mean, if you're filling out a document that you're submitting to the federal government and you see that on it that you are making representations on that document about your business under penalty of perjury and that there could be an audit, that's a scary thing. And you may be worried, if I don't understand this correctly and if I fill out this form wrong, am I gonna go to jail? Are there going to be, tax audits? And so getting people who you trust to explain to you how to fill out the form correctly, that's really important. It's also something that community organizations are going to be better suited to do than individuals in the federal government. So it's a really complicated problem. It's not something that, unfortunately, we can solve overnight, but it's something that we're really dedicated to trying to do.
Well, I have to say I'm grateful that you are doing that because I think it's important. Whatever gets started gets carried on, so it's good to get it started and to keep moving that. And I'm just one quick follow-on to that. I'm assuming that the community navigators are also linked into the regional networks that we met with earlier.
Exactly. Yeah, there's already an existing SBA regional network that's quite effective. We just thought that the community navigators were a way of sort of extending the tentacles a little bit more and getting into harder to reach communities. And that again, we are rolling out that program. We got funding for it last year, but we are making progress on that front.
Awesome. Thanks. Well, I see my colleagues have their hands raised, so I'm going to go ahead and start with all of them. Ajay, do you want to ask your question?
Thank you, Sonal. Thank you, Bharat. My name is Ajay. I'm from California. This was very insightful. In addition to all the challenges being faced by what you have listed out by the small businesses, there are a lot of opportunities in the federal, contracts and grants and things. But as a small business owner, as you pointed out, they do not understand how to go and apply for become a federal contractor or have a small business, supply to the federal needs. Or those. What efforts has been done to demystify this whole process and go in the communities around the country and tell them this is how you apply, this is how you apply for the grant, this is how you apply for the federal contracts, or this is how effectively have you used the South Asian media to reach these communities?
Yeah, great questions. I think one of the things that we are focused on is each agency has a goal about what percentage of its contract dollars should go to small businesses. And one of the concrete things that we can do is increase that goal. And then make it incumbent on the agency that, these are hypothetical, but if you go from 15% of your contracting dollars have to go to businesses with fewer than 50 employees and raise that to 20%, that's going to put the onus on the agency to figure out how to make sure you are making things easier for small businesses to apply. And so again, that is something we've been working on. The president has also issued an executive order on promoting competition throughout the American economy, which means in part helping small businesses compete on a more level playing field. One of the key ways that we can do that, and one of the directives that he had to every agency in the federal government, was that in your procurement decisions, figure out ways of making it easier for small businesses to participate and take advantage of federal contracting opportunities. So there's each agency has a different approach, but it is something that we're working hard at.
Thank you.
Rinal, do you want to
go? Yeah, my name is Reno Samoa. Thank you so much for presenting. Comment and a question. It's a little disappointing that Dr. Webb couldn't stay on, mostly because of the disproportionate impact COVID's had on Pacific Island communities. And, the drivers of that being mostly socioeconomic conditions like income level and education. So I'm hoping that in the future we can partner with them, because I didn't see in his presentation any of those root data disaggregation efforts. Everything was on downstream methods like cases and socioeconomic resources surrounding that. And those drivers are notoriously not disaggregated in Pacific Island communities. And they're going to continue to drive the pandemic for NHPI people. The second thing was, so the presentation I saw, there was a couple of notes that said NHPI not included. And most of this, I believe, was Asian American businesses. In fact, thank you for including the language that specifically just said Asian American. And a lot of business owners, Native Hawaiian Pacific Islander business owners, don't identify as Asian. So they don't know that a lot of the RFAs and initiatives are out there pertain to them. Second, what are you doing? Because it is an OMB mandate that this data is disaggregated. What are you doing to help rectify that? And what can we do as a commission to help support those efforts?
Yeah, look, I also was frustrated in trying to look through this data to find that it was not disaggregated at that level, and it was important to us and to the team that we note everywhere where that was the case, so that we weren't painting an inaccurate picture. As you said, there is a mandate or an encouragement to make progress on that front. I think that actually going through this process of preparing this presentation, for me at least, has revealed additional areas where we could use additional disaggregated data. Some of those data sources are things that we in the government directly control, right? They're government data sources, and it would be easier for us to push in that direction, and we, at least I will plan on pushing that we do so. Some of these data sources are private sector data sources. That's obviously a little bit harder, but I think one thing that you as a commission can do, and that would be helpful to have, is an encouragement for these private companies that do lots of data collection that we in the government rely on, a lot of policymakers rely on, ask them to also take the steps necessary to try and disaggregate the data.
Thank you. Victoria?
Yeah, thank you, Bharat, for just the data and the information. And, with just COVID and, this past few phases of the PPP loans, and we saw a huge gap, right, in Region 4, and I'm sure many other regions across the United States, of the small businesses, especially the LEP, limited age proficient businesses, gaining access to the resources and kind of coming on the tail end of, being able to access or be connected to like the SBA loans or the SBA representatives or the small business development centers or some of the other local resources. And I know we've been, advocating for a long time to make sure that funding is available for local partners, right? Trusted leaders in the community. And I'm so excited to hear about the Navigator program. But I also kind of echo where Mr. Carey in chat mentioned that there are a lot of these compliance and these federal grants, mandates that kind of also prevent local nonprofits or trusted leaders like, folks on the ground from accessing even those programs, right? And so I guess my question is, what are we doing to kind of ensure that more funding come through these federal agencies, whether it be like the EEOC, the SBA, or other agencies that kind of help with some of the discriminatory and, discrimination work or support for some of the communities, as well as the small business development support. And then also kind of flagging the recommendation that we just don't have enough funding for nonprofits and local leaders to do this work, and often kind of, trailing a lot of the other communities just simply because there's just not enough resources for language access and direct, consultation and support work.
Yeah, there's a lot there I want to touch on. I know we only have a few minutes, but I guess just a couple of quick points. One, when we look back at the data from 2020 on all of the distribution of small business relief, it was clear that that money was going to larger small businesses. It was going to more well-connected small businesses. It tended not to go to small businesses that were located in lower income and minority communities. And so when we came in, it was particularly important for us to try to make policy changes that address that. Now, part of the problem is that Congress writes the rules for the PPP, and we in the administration are required to follow those rules. But with the discretion that we had, we took a number of steps to try to better target the money. And one of the things that we did, for example, was announce a period of time when only companies with fewer than 20 employees could apply. The PPP, for example, is available to small businesses with up to 500 employees. But the president felt strongly that those truly small businesses with fewer than 20 employees, it may take them a little bit more time to put their applications together. We want to make sure that they are getting support. So they got this exclusivity period. And if you look back at the data overall, in 2021, under President Biden, the distribution of small business relief was much more targeted towards smaller businesses and towards businesses located in lower income minority communities. And so we're happy about that. It's not to say that we've solved every problem, but I think we are happy about that. I think one design thing that the government should keep in mind, I think, going forward, is that a lot of these relief programs are first come, first served. So they say, here's a pot of $20 billion. Everybody who's eligible applies, and then we'll fund people until we run out of money. And having those kinds of first come, first serve relief programs necessarily helps those companies that are better connected, bigger, have more resources available to them already. And so I think we've learned not to set up programs that way, right? Or at least to have programs that say a certain percentage of that relief money is going to be set aside and is only available to companies with fewer than 10 employees, or for companies that are located in lower income minority communities. So we're still learning a lot about how to better tailor and design these programs. So I think we have made progress.
All right. Unfortunately, I'm going to, Kaying and Mia, I'm going to have to cut here because we've got a very long session coming. But we would love to, re-engage with you as we start getting into our work and hopefully pushing for more of the data disaggregation that I know you're looking to do. But thank you for taking so much time. I know y'all are busy there, so really appreciate your making the time and look forward to digging into more of this data with you also. Thank you so much.
Thanks very much.
Kaying and Mia, sorry, we'll keep a running list, and we can also bring people back in. So with that, I am going to turn it over to my friend, Erica Moritsugu, who is going to master lead this next session. I hope everyone has some water and ready to go, because it's going to be a great group that's going to be speaking next.
I was just going to say, Seminole, well-deserved break. I'm going to be your release pitcher here. And I know that we're going to keep you plenty busy with the commission, and you're not looking for a new job, but if you ever wanted to be a news anchor or a marathon runner, I will be your reference. This has been an amazing run and a well-deserved break while I manage this conversation, which is exciting and sad and dark, and some of the hard work that we've got. But good morning, good afternoon, good evening. We actually have somebody calling in from Europe. So we're joined from across the nation and the globe, including our commissioners. I have the honor of introducing our next panel, which is focused on our key priority of addressing xenophobia, racism, and hate in the Asian American and Native Hawaiian Pacific Islander communities. You know, we've heard a lot of references throughout the day about the recent years, alongside with the COVID-19 pandemic, the uptick in anti-Asian hate and violence, which has surged. So our panelists today are going to share information and thoughts about the disturbing data we've seen and what the federal government and this administration and y'all as commissioners and community leaders and community members can do to address this issue. I'm going to shift a little bit in terms of the speaking order and introduce Rachel Rossi, Deputy Associate Attorney General at the United States Department of Justice. She was recently appointed to the Department of Justice as the Hate Crimes Coordinator. And in these roles, Ms. Rossi leads efforts related to criminal justice reform, community law enforcement engagement, access to justice, and combating hate crimes and bias incidents. Rachel, thank you so much for joining, and the floor is yours.
Thank you so much, Erica, and thank you for your leadership. Good afternoon, everyone. Thanks for having me here today. First, I just want to bring some warm greetings from Associate Attorney General Vanita Gupta. She regrets she's unable to attend this event today, but as I'm sure you know, Vanita Gupta is dedicated to combating hate and is leading a lot of this work at the Justice Department. She specifically sends her gratitude and congratulations to the newly launched President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders, to all of you, the presidentially appointed commissioners, to the co-chairs, Secretary Becerra and U.S. Trade Representative Ambassador Catherine Tai, and to all of the esteemed panelists and speakers who are participating in this inaugural meeting. So today I'm pleased to provide you with updates on the work of the Justice Department in combating hate crimes and incidents, xenophobia, and bias. First, I'd like to start to talk a little bit about some of the data that Erica previewed on the increase in hate. The FBI's 2020 hate crime statistics, which were released last summer, confirm what we saw, what folks have been talking about, what we've heard from communities, advocates, law enforcement agencies. Hate crimes rose in 2020 to the highest levels in more than a decade. And the majority, over 60%, were motivated by race and ethnicity. And of those, more than a third targeted African Americans. We also saw a troubling, sharp rise in reported attacks on people of Asian descent this year, including multiple terrible attacks on elderly people and women. Specifically, the data showed that anti-Asian hate increased by over 70%. This represents the highest total in more than a decade. And this sobering data still, sadly, does not fully reflect the full scope of hate that is being experienced by AA and NHPI communities across our country. Accurate data to track the full scope and the impact of hate is sorely lacking. The Justice Department unequivocally condemns hate and bias against AA and NHPI communities. We have mounted a comprehensive effort enhancing the deployment of all tools at our disposal to combat these two core problems, this rise in hate and the lack of fulsome data about the true expansive impact of hate. Attorney General Garland's first directive to the department upon assuming his role was to launch a 30-day expedited internal review to determine how the department could deploy all of the tools at its disposal to counter the recent rise in hate crimes and hate incidents. Informed by that review, on May 27th of last year, Attorney General Garland issued a comprehensive memorandum on improving the department's efforts to combat hate crimes and hate incidents. And as you know, that same month, President Biden signed the COVID-19 Hate Crimes Act and the Jabara Hire No Hate Act, which provided the department a new range of tools to combat hate crimes and incidents. In that memo, the Attorney General also designated me to serve as the department-wide hate crimes coordinator to create and centralize the department's anti-hate crime and incident resources and work to facilitate visibility and collaboration across the department's work in combating hate, and to ensure that this work is culturally and linguistically accessible, effective, and impactful. So today I'll just highlight a few areas of this work across the department. First, the Civil Rights Division continues to prioritize both the criminal and civil enforcement of hate crimes, violence, and discrimination. Since January of 2021, the department has charged more than 25 defendants with federal hate crimes. In addition, more than 20 defendants have been convicted. And the Civil Rights Division civilly can enforce federal statutes that prohibit discrimination on the basis of race, color, sex, which includes pregnancy, sexual orientation, and gender identity, disability, religion, familial status, national origin, and citizenship status. On the investigative side, the FBI has now elevated hate crimes and criminal official misconduct violations to its highest level national threat priority. This is increasing the resources for hate crimes prevention and investigations and making hate crimes a priority and focus for all 56 of the Bureau's field offices. So these enforcement and investigative efforts are critical, but we recognize at the department that tackling the complex problem of bias, hate, and xenophobia really requires much more than enforcement alone. The Justice Department is working to strategically expand and revitalize CRS, the Community Relations Service, who has regional offices across the country. CRS stands ready to work with communities that are harmed by hate incidents and hate crimes and responds to community conflicts arising from differences in race, color, national origin, gender identity, sexual orientation, religion, or disability. And CRS does not have investigative or prosecutorial authority. Rather, CRS impartially works with communities in conflict to help rebuild relationships, to facilitate mutual understanding, and to encourage and develop local solutions with state and local officials, community-based organizations, civil rights advocates, faith-based groups, and law enforcement. CRS also recently published a toolkit on preventing and responding to bias and hate incidents against Asian American, Native Hawaiian, and Pacific Islander communities. This toolkit is aimed at empowering communities to create and lead locally based anti-hate strategies. In addition, the department's hate crime enforcement and prevention grant programs also provide significant resources to support state and local partners in this work. In October, the Office of Justice Programs announced a total of $21 million in grant funding through these programs to state and local partners to investigate and prosecute hate crimes and to assist hate crime victims. And we're very hopeful that more grant funding is on the horizon as we wait for appropriation of the grant programs under the COVID-19 Hate Crimes Act and Jabara Hire No Hate Act. This funding will be critical to address one of the most significant barriers to fully tracking and understanding the impact of hate in our communities, the lack of accurate data on hate crimes and incidents. I was pleased to see that one of the express mandates for your commission is the prevention, reporting, response, and tracking of hate, anti-Asian hate crimes and hate incidents. And I believe this is an area where collaboration and partnership is really critical. We saw with the FBI's hate crime data for 2020 that for the third year in a row, the number of police agencies participating in the reporting program declined, with thousands of departments either not reporting any data to the FBI or reporting zero hate crimes. Over 12,000 law enforcement agencies affirmatively reported zero hate crimes, including 65 agencies in cities with populations over 100,000 people. We also know that trust gaps, language barriers, and other impediments create obstacles for victims to report hate crimes to law enforcement. More than 40% of all victims from 2015 through 2017 reported that they did not feel that it was productive or safe to report hate crimes to law enforcement. We also face the significant obstacle that the vast majority of bias and hate incidents may not rise to the level of a prosecutable hate crime. And we know that there are a host of inherent barriers to federal prosecutions of hate crimes, including gaps in the federal hate crime laws. So this lack of accurate data inhibits the ability of law enforcement to address and prevent hate crimes and to target the resources they have to fight hate crime. It also limits the ability for community-based intervention efforts to proactively ensure that resources and support are effectively targeted to prevent hate crime and violence. Accurate data is also critical simply in its power to acknowledge the collective trauma of impacted communities by just naming and identifying hate. Hate carries a unique impact when it is not recognized, not acknowledged, not addressed. It can leave victims and communities feeling unseen or insignificant, and that can even further exacerbate harm. So we are pleased to see that the passage of this new law and the new grant programs in Jabara Hire will tackle these problems head on. The law will prioritize grants for underreporting large law enforcement agencies, especially those who have not reported any hate crime in the last 3 years. And it will provide grants to support states and local government transition to the National Incident-Based Reporting System, or NIBRS, which is a more sophisticated and detailed crime reporting system that increases real-time reporting and transparency. To encourage victim reporting, the hate crime legislation allows for new grants to states to create state-run hate crime reporting hotlines. And it will provide for grants to assist states in conducting law enforcement activities or crime reduction programs to address hate crimes. In addition to these grants, the Act also includes a number of authorities for the department to issue guidance that will support state and local partners in the fight against hate. One of these guidances requires the Department of Justice to partner with the Department of Health and Human Services to develop guidance aimed at raising awareness in the increase in hate during the COVID-19 pandemic. This guidance is particularly critical given the resurgence of COVID-19, Omicron, and the continued increased acts of hate against the Asian American community in recent months. Last fall, Attorney General Garland and HHS Secretary Becerra convened a virtual listening session moderated by Associate Attorney General Vanita Gupta to start to guide the crafting of this guidance and what it would look like. 10 speakers from prominent anti-hate and community-based organizations, including 2 of the distinguished co-panelists on this panel here today, were present at that session, provided statements, observations, and data on the increase in hate during the pandemic and the types of guidance that would be useful. Over the past few months, together with our partners at HHS, we have conducted additional stakeholder engagement and outreach. We have collaborated with the COVID-19 Health Equity Task Force, and specifically with the subcommittee focused on combating xenophobia. So we will look forward to soon amplifying all of this feedback by issuing this guidance in coming months. So in conclusion, it is a top priority of the Justice Department to combat the scourge of hate, particularly the troubling rise in hate against AA and NHPI communities. And today I've only highlighted just a few of the many initiatives underway at the Justice Department. I know that one of the express goals for your commission is the pursuit of policies to end anti-Asian bias, xenophobia, racism, and nativism. And we look forward to working with you, supporting you, and joining you alongside you in this fight to eradicate hate. Thank you.
Deputy Associate Attorney General Rossi, thank you very much for being here with us and for us, and for leading DOJ's work around hate crimes and hate incidents. It's now my honor to turn to our next panelist, a friend and colleague, Chirag Bains, who's Deputy Assistant to the President and Deputy Director of the Domestic Policy Council. Mr. Bains previously served as the Council's Special Assistant to the President for Criminal Justice and Guns Policy. And today he's going to share a little bit about what the Domestic Policy Council is doing to address this issue. My friend, I turn it over to you.
Thank you, Erica. I appreciate your partnership in this work. I'm deeply honored to be here. Thank you to the co-chair, Secretary Becerra and Ambassador Tai. I appreciate the work of all that the commissioners are going to be putting in and their participation here. This is a particularly exciting moment. Today's inaugural commission meeting is a point of pride for President Biden. It brings to life his vision, which he set out in the executive order that he signed in May, that AA and NHPI leaders in this commission and that a reinvigorated White House initiative on AA and NHPIs are critical to the role of the federal government in addressing just a host of issues, and leveraging the power of the federal government across the interagency to combat xenophobia, racism, and hate against our communities. So I could not be more excited to be with you. It's also a sobering moment. Rachel cited the staggering 70% increase in hate crimes against AA and NHPI individuals. The statistics, she also noted that they're not complete. We have a real challenge on our hands, and other sources suggest the numbers are even higher. We are facing serious headwinds. And statistics alone, even the ones as stark as this one, the 70% figure, don't capture the devastating impact that anti-Asian hate has had on our communities. We've lost grandparents, fathers, mothers, sisters to violence. Our children and our elders have been afraid to go to school, to take public transit, or to leave their homes. Asian American businesses have been vandalized, boycotted, and forced to close. And throughout 2019 and 2020, many members of AA and NHPI communities have expressed that their pleas for help were ignored and their demands for justice went unanswered. This administration did hear those demands, and we are working to answer them. It's why the president signed into law the COVID-19 Hate Crimes Act. It's why he signed an executive order to drive an ambitious whole-of-government response to the rise in acts of anti-Asian bias and violence. In addition to requiring a central liaison to prioritize responding to this violence at DOJ, which gave rise to Deputy Associate Attorney General Rachel Rossi and her work, the EO also increased the resources and training for state and local law enforcement to accurately identify and report hate crimes to the FBI for investigation and prosecution. You heard several details about that. That's ongoing work and will continue to be a priority for this administration. Ensuring safety for AA and NHPI communities requires federal measures that are focused on prevention, intervention, response, and recovery. And the agencies are taking that mandate seriously. The Departments of Homeland Security, Justice, and Education are taking a coordinated response to the violence and threats against these communities. Starting with prevention, DHS actively evaluates reports of physical threats and incidents of violence against AA and NHPI community members so that it can determine trends and forecast potential threats facing the community in the near future. This allows DHS to prevent violence in cooperation with these communities before it occurs. Now, using that information, DHS has connected AA and NHPI communities with its network of local and regional partners across the country to assist with community-based violence prevention efforts. That work has included deploying volunteers to at-risk communities to deter attacks, and also training community leaders on the resources that are available to victims. DHS has also awarded security grants to 17 organizations serving AA and NHPIs so that local leaders can train neighborhood residents on how to establish community patrols or understand their rights in seeking assistance from law enforcement and community organizations. The threats and the violence that we've been discussing here today weren't just directed at adults and elders, but also to AA and NHPI children. Now, schools are supposed to be environments that foster friendship, curiosity, and growth. Yet during the pandemic, schools became places in which AA and NHPI individuals, children, were harassed, bullied, threatened, and harmed. This has been a problem that we have seen throughout the country, and the Department of Education is responding. It has responded by training schools and educators on their legal duties to prevent and intervene when harassment and violence are directed at students and families. The agency also is working to empower students and their families to demand justice by sharing information online on how to file a discrimination complaint with the Office of Civil Rights. And they're making that information available in 11 different languages. We know that our community is a diverse one. It's got a multitude of languages. Language access is a real barrier to government services, and it's one that we are trying to stay focused on as we dismantle barriers to accessing resources. Now, beyond physical threats and violence, xenophobia, and racism and hate incidents imperil the stability of our communities. Rachel touched on this as well, right? It's not just acts of violence, it's also the everyday racism and hate incidents that we are seeing. Many AA and NHPI small businesses were the subjects of boycotts, vandalism, and robberies, and have been in recent months and years. All of that compounded the financial strain that entrepreneurs and employees experienced and continue to experience during the pandemic. President Biden's American Rescue Plan delivered historic funding of over $36 billion to keep AA and NHPI restaurants and bars open, among other restaurant owners. Other AA and NHPI business owners were able to access over $179 billion in capital from the Small Business Administration during the pandemic. These are some of the resources the president has tried to make available, and they were crucial lifelines for many individuals in our community. For AA and NHPI families that struggled financially due to job loss and the health impacts of the pandemic, President Biden has been working to ensure that the American Rescue Plan, as it's implemented, increases nutrition, emergency rental assistance, unemployment benefits, and subsistence benefits. All of these have been estimated together to reduce poverty in AA and NHPI communities over the past year by 22%. Now, we know that delivering justice requires more than responding to the immediate recovery needs of AA and NHPIs. It demands more than responding to incidents of hate and violence as they occur on a case-by-case basis. One area that we have prioritized is working to disaggregate federal data collection by race. That has been a key request of AA and NHPI communities because that information raises the visibility of the impacts of policy decisions on AA and NHPIs. With better data, we can ensure that we're developing better policy that meets the needs of our communities. Another area is research. An example of our investment in research is the work of the National Science Foundation. It's currently funding 100 grant programs across the country that are helping a wide array of researchers advance innovative studies to reveal new and more effective strategies for reducing the frequency and severity of discrimination and violence by underrepresented and underserved groups. That includes AA and NHPI communities. Delivering safety and justice for AA and NHPI communities demands that we do more, that we break down barriers of language access, that we create opportunities so that our communities can thrive across the country. This is why we're driving a domestic policy agenda that centers equity. It's why I am very proud to be in the role I'm in, serving at the Domestic Policy Council, to center equity for the entire government. And as the Commission embarks upon its work, we in the White House welcome your recommendations on ways to continue to protect, empower, and uplift our AA and NHPI communities. I'm looking forward to being a partner to you and looking forward to the work ahead. Thank you.
Thank you, Mr. Baines. We're glad that you're here with us too. And thanks for your leadership at the Domestic Policy Council and for raising the attention of this issue that's been so heavily impactful on our AA and NHPI communities. We're going to now shift to hearing more about this issue from the White House Gender Policy Council. Our next speaker is Shilpa Sadki, who is the Deputy Director of the White House Gender Policy Council and Special Assistant to the President for Gender Policy. Ms. Sadki was previously the Vice President for the Women's Initiative at the Center for American Progress, where she oversaw policy development and analysis, as well as advocacy and outreach on a wide range of women's issues. It's my pleasure to turn the hot mic over to Shilpa. Thank you.
Thanks, Erica. And it's such a joy to be here with all of you today. There are so many amazing leaders among you, and it's just, it's a thrill personally to get to see everyone, and really just want to say congratulations. Also pleased to see so many gender justice warriors among you, and so really looking forward to the conversation. You know, I wanted to start really by just talking about the intersection of race and gender. You know, as we talk about hate and we see in hate incidents, we really see those overlapping forms of hate and misogyny and sexism and racism. And I think it's really important for us